Good. So this presentation brings us back to Nirogacestat, and I've already told you Niro and the DeFi trial have been really a success story, and I'm pretty honored as the principal investigator of DeFi to be part of this success story. And what I would like to talk about now is about the long-term treatment with Nirogacestat. That is actually an analysis I've already presented earlier this year at an ESMO Sarcoma and Rare Cancers Congress in Lugano, and I would like to present this here now. Here is my, here are my potential disclosures and conflicts of interest. So let's get started with DeFi again. I already explained you the DeFi trial in my earlier presentation today, that DeFi has been this global randomized multicenter placebo-controlled phase 3 trial, which ultimately led to the approval of Nirogacestat by the FDA and also by the European Commission now for adult patients with progressing desmoid tumors requiring systemic treatment. And you might remember that, of course, in the first part, in the what we call the double-blind part, patients have either been treated with Nirogacestat or with a placebo. And then after unblinding of the study, patients had eligible patients had the chance to continue treatment with Nirogacestat for a longer period of time. And this part of the trial was called the open label extension phase. And patients were treated up to 3 or 4 years in that part. So the objective or the idea of this analysis now is to evaluate the efficacy and safety of continuous treatment with Nirogacestat at landmark milestones of 1 to 3 and even 4 years. And these are the results I would like to show you. First of all, looking at the objective responses. The median duration of exposure with Nirogacestat was initially at the primary analysis only 21 months. And here in this longer analysis, it was up to 34 months. The overall response rate increased from 34% for patients staying on Nirogacestat for only 1 year to 46% for those on Niro for up to 4 years. So overall, we had 3 additional partial responses and 3 additional complete responses. That means the longer you treat the patients, the higher is the rate of responses, or the more responses you will see. So at the end, we had a total of 8. That means 11.4% complete responses. Patients who remained on Nirogacestat treatment sustained their patient-reported outcome gains for up to 4 years. And this is just an example here about the total symptom score. And you can see that this patient-reported outcome gain was actually captured with the different tools. It could either be captured with a tool which is used for pain, the brief pain inventory short form, which is marked in blue here, or it could be captured with a Goddess score, which I already explained. This is a desmoid tumor specific symptom score, but it could also be captured with a very conventional classic ERTC QLQC30 score, which actually captures the overall quality of life. So we have a sustained patient-reported outcome gain for up to 4 years. What about the side effects and the safety profile? The safety profile with long-term Nirogacestat treatment is very consistent with the primary analysis. So we have the same frequently reported treatment emergent adverse events, such as diarrhea, nausea, fatigue, hypophosphatemia, and headache. Most of them were grade 1 or 2, as already shown in the primary analysis. But there was one thing which I found is really interesting, that we could clearly see that the incidence and the severity of these frequently reported adverse events clearly decreased after year 1. The ovarian toxicity reports were also very consistent with the primary analysis. So no new signals here. So in conclusion, these results show that long-term efficacy and safety of a continuous treatment with Nirogacestat with an exposure of 34 months extended from the 21 months at the primary analysis. Long-term treatment with Niro was associated with an improved objective response rate, a further reduction in tumor size, a sustained gain in patient-reported outcomes, including pain, symptom severity, physical role functioning, and overall quality of life, and a manageable safety profile. And the safety profile of long-term Nirogacestat treatment was consistent with the primary analysis. So in other words, this analysis shows that you don't necessarily have to treat the patients that long, but if you want or need to treat the patients for a long period of time, Nirogacestat is extremely safe and efficacious and efficient. So thank you very much for your attention, and I would like to acknowledge the DeFi trial participants, their families and caregivers, the investigators, staff members at the trial centers, and also a very great thank you to the patient or to the involved patient organizations, the Desmoid Tumor Research Foundation and Sarcoma Patient Advocacy Global Network. Thank you very much for your attention. And again, of course, happy to take any questions.
Hello. Do you know if there was a difference between the patients who had aggressive growing tumors and the patients that didn't? Did you kind of check the data on that for the use of Ogsiveo?
Yeah, I mean, the thing is, one of the inclusion criteria for this trial was that patients had to have a 20% increase in tumor size at inclusion. So what I would like to say here is we only treated the patients who were really in need of treatment, so who had an aggressive or aggressively growing tumor. Those with let's say, an indolent, smoldering, stable tumor were not even included in this study. I hope that answers your question.
Hi, doctor. So if the tumor is responding and shrinking or stabilize, do you have a protocol on when to stop the Ogsiveo? And if we restart it, what are the risks associated with that?
Yeah, I mean, it again comes to the question about the treatment duration. And again, I have to admit that this trial was not intended to answer actually this question. So we cannot really say how long we need to treat the patients. But what this analysis shows if you treat the patients for a longer period of time, it's safe and it's a really effective drug. But I mean, I try to explain this that already in my first talk. We have a bit of experience, especially with sorafenib, and there we usually treat the patient until there is a disease stabilization, which is usually something like 9, 12, maybe 15 months. And then we can stop, and there is usually no regrowth again. But if this is actually the same here with the gamma secretase inhibitors is not yet clear. But what I can maybe also say is there is another trial currently in planning from SpringWorks which is actually looking at two aspects. It's looking at the ovarian toxicity, and secondly, it's also looking at treatment duration. So patients are treated for 1.5 or 2 years in that trial, and then they stop the drug. So maybe we will have a few more answers from that trial.
Thank you.
You're welcome.
Hi, doctor. Have you seen any negative effects to the liver for the longer you're on the drug, like with liver enzymes being elevated?
Nothing special here, no.
Hi, doctor. We just recently saw my daughter's oncologist, and she was put on Nirogacestat, and they mentioned that there's a chance of lesions that can turn cancerous, that they want to check her monthly, her skin for that. I'd never read anything or heard anything about that before. Is that something you guys have seen?
Yes, that's right. There is a non-melanoma skin cancer that has been seen. I mean, overall, there were actually 3 events in that trial in 2 patients. And I mean, all of them were actually removed. And so there was no problems at all at the end. But yes, this is something you should have keep an eye on.
Okay, thank you.
Hi. So you were talking about like the duration. What about how long did the person have to, like the patients have to be on it before they saw any results? Like if somebody was on it for a year and then there was nothing, did you like stop the medication, or like is there results after a year?
Yeah, I mean, usually, actually, clinically, you see results or improvement usually very rapidly. So an improvement in symptoms, improvement in pain, improvement in functioning, or something like that is something you see in a few days or weeks. But I mean, on the MRI or radiologically, you usually see something after several months. So if you do the first MRI after 3 months, there might be a stabilization or even a slight regression. But this is the usual, I would say. And then you see more regression at 6 months and so on. But yeah, so there is a faster response clinically, and the radiological response takes a bit more time.
Okay, thank you.
Hello. Did you see a lot of adverse impacts related to the eyes, swelling around the eyes and halos?
No.
Vision halos? No?
Nothing special, no.